Hey guys, what are the harms of ultra-processed foods? Let's talk about it. So lots of different studies have linked consumption of ultra-processed foods to bad health outcomes. This is a new study in the British Medical Journal that's actually what's called an umbrella review. So it's kind of a review of reviews, and they bring together 45 different meta-analyses, which ultimately means data from almost 10 million patients. And they're able to reach some very important conclusions about the kinds of health impacts of these ultra-processed foods. So they found 32 different health impacts of consuming ultra-processed foods, and it really runs the gamut from respiratory to cardiovascular, mental health, cancer, gastrointestinal, you name it, pretty much every system. The big ones are 50% or so higher risk of dying of cardiovascular disease, also just higher chance of having anxiety, having certain mental health disturbance, sleep disorder, obesity, type 2 diabetes, 20% higher chance of dying of any cause, and the list goes on and on. There are certain cancers in there as well. The links to cancer are less well established, but many different health outcomes from consuming these kinds of foods. So what is an ultra-processed food? We're talking about foods that go through these industrial processes where it really changes their chemical composition, and they're trying to make the foods last longer, taste better, look better, improve their texture. So there are preservatives added, flavorings, colorings, emulsifiers. They're adding salt, sugar, unhealthy fat. Ultimately, they're removing, or you're losing, some of the fiber in there. You're losing the vitamins, the micronutrients. What you end up with has very little of the whole or original food. So what kinds of foods are we talking about? A good rule of thumb is if it's prepackaged and ready to eat, it's probably an ultra-processed food. So things like protein bars, things like even cans of soup, instant noodles, sugary cereals, soft drinks, French fries, chicken nuggets, candy, fizzy drinks. I mean, the list goes on and on. And unfortunately, in Western countries, we get a majority of our daily calories from ultra-processed foods. In Canada, on average, it's about 50% of our daily calories, and that's because these foods are all around. They're really convenient. They're really energy rich, and they last a long time, and this is what we have in our pantries, and they get us through our day. So what can we do to mitigate the risk? I don't think we're going to be able to cut these foods out completely, but if you go from 50% of your calories to around 20 to 30% of your calories, and you limit yourself to 2 or less servings per day, you will probably mitigate a lot of that risk. And a big part of this is just educating people about these risks. Some countries are actually putting labels on ultra-processed foods, warning labels. Some countries, particularly in Latin America, are preventing marketing to children. They're actually preventing sale of some of these kinds of foods in schools. So there are some public health measures that can be taken as well. But the big thing is just awareness, and for us to start finding ways to change our diet.